So this marks now our sixth session in our Centre's Primers and Provocation series. It's also the last session for 2023. We will be sharing our program for 2024 soon. But for today, we are welcoming Iveta Tsenkova, a PhD candidate based in the Department of Psychological Medicine at the IOPPN here at King's College London. Iveta's PhD project focuses on realist evaluation of psychosocial substance use intervention for young adults who experience housing insecurity. So we have an expert with us who will introduce us to the method of realist evaluation. Iveta will provide a brief introduction to the theoretical background of this method rooted in critical realism, and then explain how the method is applied by the Medical Research Council's relatively new framework for evaluating complex interventions. There will be ample of opportunity for questions and clarification. So Iveta will have 2 points in the presentation where you can put questions in the chat or raise your hand, I suppose, and ask. But then at the end, there will also be a Q&A. So please feel free to use the chat for comments and questions. And then we'll have some dedicated time, towards the end of the session for some interaction with the audience. So without further ado, Iveta, I'm handing the floor over to you.
Lovely. Thank you so much. I am just going to share my slides now, and hopefully you're all able to see. Perfect. Okay. Well, thank you so much for this opportunity, and hopefully this will be helpful and useful for you. So as Hannah said, I'll provide a brief introduction into realist evaluation. So we're thinking around evaluating interventions around how they work, who they work for, in what context, and for who exactly. So wait, 1 sec. Okay, on my next slide. This is kind of like what we will run through. I will very briefly talk about the MRC framework and how that is related to why exactly I'm talking about realist evaluations. And then I will provide a brief introduction of the overall realist evaluation. Then we'll take a brief break for any questions. I will introduce all assumptions centered around context mechanisms, outcomes, and CMO configurations, what those are. And then we'll hopefully have enough time to provide you with a brief overview of analysis pathway following one paper, which you will see in the slides. Okay, so I will, amazing, everything's working. Okay, so as I said, we're thinking around evaluating interventions in terms of the relatively new Medical Research Council framework. So as you know, that was commissioned and it came out around 2021, and it provided some guidance on conceptual, methodological, and theoretical development for evaluating interventions. And we're thinking specifically around our complex interventions. So as you know, complex interventions, they are complex because of multiple reasons. It could be around the number of components that they have, range of behaviors they're evaluating, skills required from staff, and other reasons. But we're also thinking around our complex intervention in the grander scheme of things. So we're thinking around the interactions of interventions with the overall environment and how environment could influence intervention and its outcomes. So we're just kind of focusing around those components, and the MRC framework kind of provided some overview of 4 research perspectives, which you can see on the screen. So we had the efficacy, effectiveness, theory-based, and systems. So what and where we're focusing around is the theory-based perspective. So kind of thinking around what works, in what circumstances, how. And realist evaluation is a type of a theory-based evaluation for interventions. And this is where we're moving on to what actually realist evaluations is. Okay, So on the screen in the top right corner, you can see this is the front page of the book, Realistic Evaluation. So it was developed and published 1997 by Pawson and Tilley. And it basically is the beginning of where realist evaluation were introduced. So it says realistic evaluation that was later changed to realist evaluation. So you can see that's a bit in the literature as either, but they refer to the same type of evaluation. The idea of realist evaluation. So realist evaluation is based on a realist philosophy. It's grounded in the idea that the real world and reality as such exists outside of the individual, but based on individual subjective interpretation, it can be constructed and contextualized for each individual. So the reality that one perceives may be different in some perspectives to another person's reality. So realist philosophy is then grounded into two types of realist perspectives in social science, and we have critical realism and empirical realism. Critical realism, which assumes that there will always be an excess of explanatory possibilities, some of which may be mistaken, and empirical realism, which assumes that a researcher should aim to decide between alternative explanations, despite the knowledge that further explanatory potentials remain without investigation in the open world. So what does that actually mean for us when we're thinking about evaluating interventions? And how does it fit with the realist evaluation? So the idea is that if we assume our realist philosophy perspective, this means that interventions and social programs in general, they will be perceived differently by different people, and that different people would interact differently with different interventions. So everything could be very specific to our individual in their specific context in that specific point of time. So that means that realist evaluations in general think about interventions as part of an embedded, active, and big social open system. And it has key requirements as such that realist evaluation needs to evaluate the different layers of social reality for the individual and how they might interact with components of the intervention into creating a response in an individual when they think about, when they interact with the intervention to create our outcomes. So as such, realist evaluations don't think about explaining like what works or does this program work, does this intervention work. It focuses and assesses more specific questions of what works or doesn't work specifically for whom, to what extent does it work, in which circumstances does it work, and how exactly it works. So there is a big focus on thinking around the black boxes of, oh, this is our intervention, this is our outcome, what happens? How exactly was the change created? And this is very brief of like introduction of what this is. I'm sorry, I have like a little window from Zoom, which is distracting me. So this is a very brief introduction of the idea of why we do realist evaluation. I have a little break here if you wanted to ask a bit of questions before we move on, and I'll introduce the components of the realist evaluations and how we do those.
Yeah, hello.
Hi.
I'm fine. I just have a quick question. I'm wondering if realist evaluation could be used in conjunction with systematic reviewing, or they are totally different things or they could be used both.
So we can use systematic review to inform our realist evaluation, or there is another type of reviews which is called realist reviews as well, which can also be used. So if we're thinking around our realist evaluations are based in theory, and if we're really interested in finding out more around different perspectives and different theoretical social theories, which we would like to include and evaluate, then we can use a systematic review centered around that in our specific area to inform the development of the realist evaluation that we'll be later on using to evaluate the actual programs.
All right, thank you. That's very helpful.
Yeah, okay. Lovely, thank you. Amazing. I can't see anything else at the moment, Hannah, so I'm going to continue. Lovely. Thank you. Okay, so thinking around our realist evaluation. So the idea is that we are thinking about having this theory that we mentioned, and we want to evaluate how the intervention is working for our specific population in the specific context in the specific way, and finding out, you know, is this actually the way that we think it is working? So we want to build a theory in itself, a program theory. So what those program theories are composed of is these assumptions that I will go through now. So we have the context, which I already used the terminology, apologies, but context is basically the situation, this is the environment of the individual, the environment of the intervention itself, in which the intervention itself is being delivered. So the context is where we operate. And there's two types of context, as you can see on the screen. So we have our individual context and our intervention context. So on the right side, I've put down two examples. As Hannah mentioned, my research is in psychosocial interventions for substance use, for homeless or housing individuals in housing insecurity. So this is where the example will be coming from. But what I would like to show you is that we can build a lot of different types of contextual influences, and we can think about context quite broadly. It can be quite specific. And these two examples are examples from a very, very big list of contexts that I began my work with. So we have clients who exhibit high levels of disaffiliation when accessing services, so how engaged they are with other services at the time. And that is a context which is specific for my individuals or my participants who are accessing the services. And then we have types of modality of delivery, in-person, online, hybrid, which is centered around the intervention itself. So basically what it can be is that the context very broadly can be almost anything that you can think of in the environment, in the open world, that could be influencing our individual, that could be influencing our delivery. More importantly, we move on to our mechanisms, where it becomes a little bit more complicated. So our mechanism, or as I mentioned, the black box of what happens in the intervention itself, how it creates the change. So the idea is that the mechanisms could be hidden components, or it could be something that it could be quite easily accessible, but they bring about the change itself. So we have two types of mechanisms, as I have pointed out. We have resources and response. So resources, mechanism resources, that could be anything related to the intervention itself and what it delivers. So I've given an example here as harm reduction. So if you think about any types of leaflets that could be centered around how to reduce harm of substance use, those are mechanism of resources for this intervention. Something that's important to think about is that our context of the intervention itself could also be influencing the resource. So the mechanism and the mechanism and the context are not separate entities. They influence each other at different times, in different ways, or all the time. And then we have our mechanism of response, which is basically the change that is being triggered, the change that we're looking for. And I have put down here, it's clients reflecting and addressing their risk-taking behavior. So if we have that our mechanism resources harm reduction, I'm going to talk about how to reduce a specific harm related to my client's substance use. Okay, but is that creating the response that I was looking for, and my client reflecting and addressing and thinking about their risk-taking behaviors, them reducing them that risk themselves, right? Okay, and then we obviously have our outcomes. And when we think about outcomes, we have intended and unintended consequences and intended outcomes. So here I've provided the two types. So I have reduction in substance use, which is an intended outcome of any substance use or service. It's reduction or abstinence. And then we have reduction in housing insecurity. So it's an unintended outcome that could be observed, that could be important for the clients, and it could be important for staff, but it's not an intended outcome of the intervention overall. So when it comes to realist evaluation, we have the opportunity to actually think about and explore both these type of outcomes and include those in our configurations. So basically everything that I went through now, those three assumptions, we have our context, our mechanisms, and our outcomes. We can build those based on the systematics review, realist reviews, or any type of literature searches that we have done that are related to how the intervention works and the theory behind it. And what happens is that we usually come up with really long lists of what those contexts are, what those mechanisms could be, what those outcomes are, and we create these configurations. So CMO configurations is the short version for it. And the figure that you've seen, I've adapted from a paper from Taukin et al. From 2015. And if you're interested, this paper introduces very well what a mechanism is. So if you wanted to read a little bit more about mechanisms. So if you look at the graph, it kind of has, it seems like there is a one direction, but it's important to think about it. There actually could be another direction of influence from context to mechanisms as well, as I mentioned before, when we're thinking about our resources and, for example, a leaflet or the way harm reduction is delivered in each individual service. So our CMO configurations is basically how we link up individual context, intervention context with our mechanism, resources, and responses to generate those outcomes. So the process of creating those, we call the first phase of realist evaluation, and it's very much centered around, okay, so we had all these like big list of all the context, all the mechanisms that could come up, all of the outcomes. So how do they relate to each other? What can we evaluate in itself? And what would be useful to know for the intervention so that we can create knowledge that could be effective for our applied setting. Okay, so as I mentioned, this is very briefly what my overarching research questions are. So do psychosocial substance use interventions work for young homeless individuals? And then I have a second question of what are the conditions of effectiveness for that specific group? So going from some of the examples that I gave you, this is what a CMO configuration looks for me centered around those questions. So my context is, I focus here on specific individual context, so that's clients who exhibit high levels of disaffiliation. Then I have a specific mechanism resource, so providing information or safer drug use. And I have not included this in the slide, but in the form of a leaflet or a pamphlet or information. Then we have our mechanism resource, so clients reflect and address their risk-taking behaviors, and then we have our outcomes. So lower levels of substance use and housing insecurity, lower level of housing insecurity. So this is kind of like how we travel from building all individual components into one configuration so that we can then progress on and evaluate the actual intervention. Okay, so I'm going to take another break here in case there are some questions at this point. If there aren't, that's absolutely fine. We can continue to the next stage.
I suppose I was just going to comment if that's okay. I was just wondering, I guess can you hear me okay? Sorry.
Sorry, I saw Bethan had her hand
Oh, sorry.
raised
Go on.
first, so maybe
That's
we'll
okay,
go for-
Thomas. Go
Yeah.
first, and then
Okay.
I'll wait. That's fine.
Brilliant.
Oh, you sure? Sorry, I didn't see the hands. Yeah, I was just wondering, I guess those slides you just went through in this period, it reminded me a little bit of like what people do for logic modeling and stuff like that, and look quite similar, maybe a little bit more in depth than that. Is that something you've come across? And I'd be interested in hearing how it sort of differs, if so.
It's a type, if I can put it like this. So logic models could be a type of a theory that were investigated within this. So if the said intervention already has a model, a theory model of how it works, then that could be basically you build on that, and you introduce, if you wanted to introduce any new components around context and mechanisms to evaluate that. And
Okay.
I'm hoping that that kind of makes sense.
No, it's good. Yeah, it's good to know. Thank you.
Bethan?
I guess my point is quite interrelated to Thomas's, because I've used a different theory-based approach to intervention evaluation before. I've used intervention mapping, and I love realist evaluation. But what I find sometimes lacking is the mechanisms. They lack a bit of detail. So there's quite a big jump from, and I'm just looking at your mechanism, from providing someone with information for them then reflecting on it, and it's quite a big leap. Whereas, for example, in intervention mapping, you might then explore, well, how that information changed their attitudes and beliefs, what other supports might be there. And I'm just wondering whether realist evaluation provides that level of detail, or is it a preference just to go for these high level things without breaking that jump down, I guess?
So in complete honesty, I'm not familiar with intervention mapping, so I can't compare in that respect.
Yeah.
But based on kind of like what I have provided, so these are the example that I gave as such in terms of my the mechanisms that I have chosen, and I chose to have that mechanism specifically, and it was kind of centered around some conversations that I had with stakeholders. And basically, we had a bit of a lack of knowledge of how things happen. So part of what I will be doing is in interviews with clients and with staff to be nitpicking a little bit and finding out what happens in between that jump and if we can refine that. So in a way, the CMO configurations itself is a starting point, and then with our data and with our analysis, we kind of try and refine those continuously. So at the moment, I can't give you anything refined because I haven't reached that stage in my analysis. But as I will show, actually, I can show you over here very quickly. The idea is that once I begin data analysis, I can go back and refine those CMOs to continue to narrow things down, as you're saying, with the mechanisms and sorry, the responses. Does it?
Yeah, and it's not just. It does, yeah. Thank you. And it's not just you. I've seen this quite a lot with realist evaluations. They're quite, headline, simple, quite things. And I guess I'm a details person. I want to know what the finer details. But yes, thank you very much for explaining that. That's really, really helpful. And I'm really enjoying your presentation. So thank you.
Thank you. Okay. Do we have anything else, Hannah, at the moment? Okay, well, that's perfect because, well, it led us to our next stage. So thank you for the question, Bethan, actually, because now I can very nicely introduce the analysis pathway. So yes, overall, the realist evaluation is an iterative process. We continuously go through refinements, and the idea is that if you start with one CMO, you might very well end with slightly something very, very different or slightly different, depending on how it was constructed. Okay, so this slide, the theory that you're seeing is a copy from the Gilmore et al. Paper from 2019. And the idea is that it is showing an analysis pathway that they incorporated in their realist evaluation. So they conducted 2 realist evaluation and they presented this analysis pathway. And the thing is that with realist evaluation, there isn't like a particular tool or methods that is being used. So it's very much centered around what we're looking for to investigate and how best to achieve that. But because we're thinking around many contexts and individual intervention contexts, in a lot of the cases, in all of the situations when we do realist evaluations, we have multiple cases of the same intervention being delivered in different settings by different organizations or in different locations. So the graph has a lot of information on it, and there is some new theories, like concepts that are included here. So our middle range theory, the idea is that when we start realist evaluations, we go from very broad social behavior and change theories, and then we want to ground those to our particular situations. So that's where the middle range theories are. So they're between our context-specific hypothesis and those grand theories. And what we do is, based on those grand theories, we then think about our program theories. And you can think of program theories basically as our CMO and how that CMO is tied to a particular theoretical underpinning. So as I mentioned before, the first part is how do we inform, how do we identify those theories? And as it mentions here, there is multiple ways you can do that, because realist evaluation is not necessarily looking just for realist evaluation. Don't look at information just generated from articles, journal articles and manuscripts. We do include a lot of stakeholder involvement from different levels, practitioners, clients. We think about documentary analysis. It could, like, a lot of sources could inform it. So that's our phase 1. Then we go to our phase 2, which is similar to other types of evaluation. We think about our design and we think about our data collection. I can say that a lot of, sorry, a lot of realist evaluations in the health settings that I have come across use mixed methods, but it's not necessary to be just the case. You can choose based on the CMOs that you want to evaluate themselves and the data that you will need, how you can best create that study design for yourself and for your particular questions. So the important part is when we move on to our data analysis and our phase 3, where we can begin the data analysis. We can think about how the data that we have collected, say from one case, from one site that we have, we're evaluating, how that relates to our CMOs that we have come up with, whether we need to be refining our mechanisms, whether the mechanisms that we're looking at actually have not been identified. So, for example, in my case, it will be my qualitative interviews with staff and clients inform the ways that I think about mechanisms and what mechanisms are being in use. So are the interviews giving me that information of the mechanisms that I have identified, or is it something different that we're looking at? And here is where we can again go back to the CMOs, reconfigure, think about whether we need to do another data collection around how we need to address this. And basically, the process can be endless. So it can go through many iterations, many refinements before we move on. It depends on timelines, and it also depends on availability of data and our willingness of gatekeepers to work with us. Moving on to phase 4 is then when we think about, okay, we're going to synthesize what we have come up with. We have our CMOs that have emerged from the synthesis of all of the data for this specific case. So I'm going to refine this, I'm going to relate this to theory, and then we're thinking about, okay, so this is what came up from our case. Before we move on to phase 5, where we compare between cases. And if that is if needed. Some realist evaluations don't do between case comparisons. So we have realist evaluations that work with one side in specific as well. So yes, in phase 5, we do our comparisons and refinements between cases. This is where we can also think about our context-specific geo interventions, and we can think about external environmental factors related to intervention setting. For example, location. And then we go back to our program theories. We evaluate, okay, so our CMOs, this is between context, what has happened, this is between each individual case, how our mechanisms have worked. The next step would be to then once again think about our mid-range theories and think about those overarching theories of social behavior and change, and how those might be related to our programs and our interventions, and how we might need to create that change. Okay, so, sorry. Okay, I wanted to give you a bit of an example of kind of like initial stages of what that might look like. So as I said, I presented my overarching research questions and what a CMO configuration looks in relation to that. So the next step of what I did when I was constructing the Realist evaluation is then to think about individual research questions that are related to that CMO. So this helps to think about the type of data that I'm looking at, the type of analysis that would be needed. So as you can see, I'm just going to move on. Okay, this is a lot better now. So as you can see, the research questions are related to the specific CMO configuration, but then they think about the different parts of it. So we think about the risk-taking behaviors and trajectories of those. We think about the levels of substance use, the levels of housing insecurity, how that's changed. How do clients themselves reflect on change in attitudes and beliefs? How do they reflect on those risk-taking behaviors, basically? And what is the apologies. What is the contributing factors to thinking around potentially changing those behaviors? So here is where I incorporated the level of thinking around the type of data, how data will be incorporated, how data will be analyzed in a mixed methods setting. So in my particular case, my quantitative data is focused around the outcomes themselves, trajectory of outcomes based on different subgroups, and that is around our housing insecurity. And then the qualitative data and the qualitative interviews, as I mentioned before, are more focused around the mechanisms themselves. So there's different types of ways of doing this, of ways of incorporating the data into the analysis in Realist evaluations. And in the paper that I mentioned and I showed the graph in the beginning, Gilmore et al., they give another way of doing this, where when we analyze our data, everything is considered as their individual components of the context, the mechanism, the outcome, and the association between those. So if you would like to have a look, the Gilmore et al. Paper gives a good introduction to a type of analysis and synthesis of Realist data. But something to be aware of is that Realist evaluation, there's a lot of resources in introduction and the different components, what these things mean, how that is related to philosophical background of critical realism, empirical realism. But the analysis on how that is done could be a bit vague. So if you would like to discuss or have other questions, we can do that sometime. But that's why I'm pointing towards the paper, because it does give a good overview of a type of how this analysis is being done, going through the different phases of a Realist evaluation. And that is the Gilmore et al. Okay, so our last slide is centered around, okay, now we know what Realist evaluation is, what do we use it for, when do we use it more specifically? And very briefly is where I've outlined when to use. Basically, when we're evaluating something new, we're piloting a new intervention, it could be good for us to understand our mechanisms of, are we doing what we think we're doing? when we're evaluating any interventions that may need to be adapted to a particular context. So here is where my kind of research would fall under, thinking around specifically individuals in housing insecurity and how an intervention is being delivered to the general population, but could we and should we refine this specifically for the population in housing insecurity? And then we have the other scenario, evaluating interventions that have previously had mixed results. And this can, because realist evaluation can help us understand, you know, what is working, to what extent is it working for specific populations, and why. When not to use real evaluations, if it's already known how an intervention works, as a country, if stakeholders are only interested in knowing whether or not an intervention works, and if stakeholders are only interested in average effects across population. So it does depend on where does the buy-in come from for our realist evaluation, what kind of information is needed, and why. Okay, so very briefly, this was what I had. I can leave the slide on for a few minutes if you want to take a screenshot or just have a look at some of the articles. Yeah, thank you.
Thank you very much, Iveta. This was a really informative, brilliant presentation, and I think very useful for many of us in the audience. And I can see already questions in the chat. So what I'm going to do is I will keep an eye out on people who are raising their hands, while I'm also going to go through the chat and do a bit of a back and forth if it allows. So we have quite a bit of time for questions and answers, which is great. So I will start out with Tessa's question. Would a theory of change-based evaluation be considered a realist approach? And Tessa, of course, feel free to elaborate if you would like.
No, I guess I'm just sort of building on what others have asked, of trying to figure out how this fits with similar approaches. And I'd be interested to hear, you know, is theory of change part of that sort of realist family, or if there are differences, what are the differences? Because it looks very similar to, yeah, sort of theory of change based ways of spelling out the mechanisms and the context and then testing those individual bits.
Okay, theory of change and how that is basically, okay,
Is a
I'm not
theory
sure.
of change another word, sorry, for a program theory?
So as far as I'm familiar, theory of change is a different type of a theory-based evaluation, basically.
So what are the differences between what you've spelt out for realist evaluation and sort of other approaches like theory of change?
I have to be honest, I don't know too much about theory of change to be able to spell out the differences. What I do know is that with realist evaluations, you have a more of an onus on the mechanisms and bringing out the extent to which an intervention works and the who specifically it might work for in different settings. I don't want to say anything that might be wrong, so I can look into it more and then we can continue this conversation. I'm sorry, I can't answer this very well.
On the spot. I guess I'm just sort of thinking out loud of trying to, yeah, see how all of these different approaches fit together. But thank you. No, this is something really helpful.
Yeah, and just wondering before going on to the next question, if there is someone in the room who has more experience in this sort of comparative work, who has done both and wants to quickly reflect in this space, very welcome to.
Definitely very welcome to.
Yeah, otherwise I'm going to move on to Range. I hope I am pronouncing your name correctly. And Mariana, did you want to come in?
Yeah, I just wanted to briefly mention that I did use a realist evaluation for an intervention, and I used, you know, what you were saying about the context, mechanism, and outcomes to report an intervention that was tested in a feasibility study, and this was published in the Social Science and Medicine in the qualitative research. I can put the link of the paper in the chat, but I think your presentation was very, very helpful to make it very clear in terms of the structure and the theory behind it. And I find it useful, really, especially to really pin out what is the context and how the context has an impact on the mechanisms and what are indeed the mechanisms, which sometimes we don't really think so much about in that granularity. But I'll put the link of that paper in the chat as an example.
Yes, thank you.
Good. So there's another question in the chat. For phase 1, what is your description of the process of checking all the sources you named? That is it a realist review, realist synthesis, or scoping review?
Okay. I'm sorry. I'm just going to briefly read it because I don't perceive information very well verbally. What is it? Okay. So I would say there's different ways. I've seen people do it differently, to be honest, for phase 1. The way that I did my phase 1 is I did a systematic review of theoretical underpinnings and frameworks of the way that substance use is linked to youth homelessness in general. So in a way, understanding of the theory of how and why is homelessness related to substance use and why there's such high prevalence for it. And then moving on to a literature search of substance use interventions, specifically psychosocial interventions, and how and what outcomes they have in relation to the population, and then moving on to stakeholder involvement. There is realist reviews, realist synthesis, scoping reviews. So there are different ways of doing this process. Some people choose to do a realist synthesis, realist reviews, instead of going through systematics review and then literature searches. I think it would depend on what you're looking at exactly and what type of literature is available. So for me, there wasn't specifically that much literature linking theory to the substance use interventions, and this is kind of like where I needed to expand on more. So that's how I linked my overarching middle range theories to specifically the setting of the context of substance use interventions. I think it's if you look at the Romesa's website, so there you can find a lot of information of realist evaluations, but also around reviews and synthesis. So it can give you a bit of an idea whether that could be more helpful and more useful for your specific situation, your specific review. Your specific evaluation.
Thank you very much, Iveta. There was a hand up now, it disappeared. Kitty Saunders, would you still like to come in?
Hi, thanks, Hannah. I hope you can hear me okay.
Yeah.
I was just going to add to the conversation about theory of change and realism. So my understanding is that the focus of the realist approach is really the why rather than the theory of change, like steps that are involved to make something successful or not successful. But when you consider the mechanism in 2 parts, the resource and the response is quite often a kind of social, person-centric aspect to the mechanism. And that's quite central to realism as an approach. And I wonder if that maybe helps differentiate them a little bit in terms of a kind of steps towards success versus actually why that step is leading to success, which is often a kind of social-centered answer. Yeah, that's all I wanted to say. Thank you.
Thank you very much. Very helpful.
Thank you.
I'm moving on to a question again in the chat, and I'm happy to post it again at the bottom so you don't have to scroll, Iveta. How would a question about barriers and facilitators to service use fit into this framework? posting it below. If
Also, so that was a big part of my stakeholders' input. So if we think around when I was conducting my literature search, in what are the outcomes in substance use interventions for homeless individuals or individuals in housing insecurity, a lot of barriers and came up. So there was like a lot of barriers and facilitators of how this can be improved and specific. So that also came up in stakeholder involvement. So the way that or incorporating that is to think around those specific barriers, so breaking those into an individual barriers, and then thinking around how they affect the mechanisms, or if they can be included as a type of a context, either specific to the intervention or to the individuals. So I can give you an example because I think that can illustrate what I'm trying to say better. So a lot of individuals in housing insecurity have identified that they can't access specific services because of their housing situation. And then that is a barrier. So that also extends from outside of substance use services to mental health services and other type of services. So I have identified this as a particular context of in one of my other CMO configurations, but it's a specific context of the intervention itself, of how they reflect on that barrier, whether that has been addressed in the way that their intervention is structured and delivered. And I've also included it in another configuration in terms of a mechanism because of that barrier of individuals not being able to access in specific mental health services. So how does that affect their outcomes? How does that affect the way that they engage in the substance use intervention, the way that they engage with staff, and then overall their long-term outcomes? I'm hoping that this kind of answers your question, but in the way you can fit it in, basically, either as a context, as a mechanism, it depends on how it reflects and reacts with the other moving components of it.
Thanks so much. That's really, really clear.
Yeah, thank you. I have a question that might relate somewhat to the facilitators and barriers, but it sits slightly next to that. And so what I understand is that you're looking at how, by providing, let's say, information or something else, a type of intervention, someone is able to change their behavior. And thanks to that and also other environmental factors, the person may or may not get better. Right? Am I understanding that correct? So I was wondering, what if your intervention was not so much geared towards the individual, but the environment? So for example, if there's an understanding that an individual can't really change their behavior, I'm thinking about asylum seekers who are put in precarious housing situations by the government, say, and they can't change, no matter how much you raise their awareness about their housing situation, they cannot change it. And so my intervention would be geared towards the context. I would want to change the context and then see how it affects people's well-being over time. So my intervention is not geared towards the individual, but on the context. So what I want to change is not the behavior, but the context. Would realist evaluation be something to be used in this case? And I would just sort of look at how the context is changing and thereby changing a person's well-being within it. Or would I necessarily have to focus on behavior change, because that can be tricky in certain situations where people, well, can't really be expected to change their behavior. I'm not sure if this is clear. This is what I'm grappling with.
I think I understand what you're asking, I think. But okay, so if in a way, the mechanisms are very much grounded in the individual and the social context. So I think it was Kitty when she was giving us a bit more information around theory of change and the differences. There is a good example in the realistic evaluation book from Pawson and Tilley. So they think about the way that educational components are provided in prison and how that affects the outcomes after prisoners exit and I think it was their work environment after that. But once again, it's very much focused on the individual. So what that component of the intervention itself, what's basically, the educational that is being provided, how that affects the individual, how much they attend, what's like kind of like things that they attend, and how that relates to their long-term outcome after the exit and their work situation then. So in this example that you're giving, I'm not sure because like as you're saying, like the intervention is targeting the context, so I'm not sure how that would apply to the individual when you're thinking about the mechanism, but we can have a conversation.
Thank you. And I think Bethan, you wanted to come in.
I think it's related to what you're saying, Hannah. So I noticed the context, Iveta, and I was wondering why you decided to frame the context in that way and not services are entirely inaccessible because services are under-resourced, or, you know, something you specifically put the context as these people don't engage or are difficult to engage. So I wonder why you framed that raw, and I'm wondering whether, Hannah, that's what you're trying to possibly get at as well, is the context is much more than the individual. So there are lots of life chances, policies, other things happening in society that might lead to the behavior that you're trying to change. So I guess the question is, why did you decide to focus on that specific context?
I have a total of 4 CMO configurations that I'm investigating. So the one that I chose to present this one because as an example, because I think it's easier for people to kind of like understand if they don't have the knowledge in the specific field that I'm within. I have a specific CMO which targets around the intervention setting. So in a way, the way that I've structured my configurations is splitting the individual specific context and the intervention specific context. And that's later investigating. So okay, I'm gonna backtrack a little bit. The idea is that this whole of these configurations that I'm doing, I'm investigating between sites, and I have 4 cases of like different sites where this is being done, and I'm focusing the context of the individual on 3 of my configurations, and then I look at the context of the intervention in one of the CMO configurations. But when I do my analysis, I analyze each CMO within that specific case, within that specific intervention site, and like a particular factors that could relate to that. So when it comes to the disaffiliation that I was talking about, I think about and like something that I relate to it is whether there's availability of housing services, whether there is an established referral pathway between the substance use service and the housing organization. So in a way, I just kind of like really focused in on something for the presentation to kind of make it a little bit more accessible. But I'm happy to discuss this further, of like how to incorporate the different levels of the context and the systems.
That's really helpful, Iveta, because it is so complicated, and I've come to this with a bit, you know, a background knowledge. But when you're new to this, it does feel really overwhelming. So yeah, it's hard to know where to pitch it, isn't it? And you've chosen, I'm getting you've chosen one example to illustrate the method, and to avoid confusing us, the additional things. That's really helpful. Thank you.
Yeah, thank you so much, and thank you all for this engaging conversation. And I think lots of learning happening in this space. So this is great. We're coming to the end of the session. So thank you again. Huge thank you to you, Iveta, for talking to us about realist evaluation. I suppose people can get in touch with you if they have further questions. So please do that. Also, as part of the Centre's Research Methods Toolkit, we have created a page on realist evaluation that maybe, Ginny, you can share in the chat. Thank you so much. On cue. Very helpful. And then before you all leave, we would really appreciate if you could fill out a feedback poll that Ginny is going to create now, so that we can have a sense of how the session was for you, especially as we are preparing another round of primers and provocations for 2024. So this will really help us, and yeah, thank you very much. And huge thank you to you, Iveta, for such a great, clear, insightful presentation. Thank you.
Thank you so much, everyone.